And I have the pleasure of welcoming you to the national briefing by the Presidential Task Force. We will maintain our format. The chairman will open the session with his remarks, after which we shall take the technical updates from the Honorable Minister of Health, the DG NCDC, and the National Coordinator in that order. Thereafter, there are updates from the Honorable Ministers. We'll take those updates. Then we'll move over to the question session. At this point, let me invite the chairman of the Presidential Task Force on COVID-19 to the podium for his remarks. Mr. Chairman.
Task Force, distinguished ladies and gentlemen of the press, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 31st of August, 2020. As we enter the last few days of the extended ease lockdown phase of the nation's response this week, the Presidential Task Force, like the global community, is confronted with a series of emerging new developments around the characteristics of the COVID-19 pandemic. As we are all aware, the global number of confirmed cases has exceeded the 25 million mark. This is attributable to resurgence in countries hitherto considered to have effectively contained the virus, while a good number of countries that have relaxed restriction measures are others actually reintroducing such, which in some cases are being made more stringent on the basis of lessons learned. The Presidential Task Force has observed that South Africa is no longer in the top 5 with the global cumulative cases. It has similarly observed that Ethiopia is also rising strongly. The Presidential Task Force will continue to monitor developments all over Africa, even as we prepare to open up the international airspace for flights. The Presidential Task Force has also observed that from the point the global numbers entered the 28 million, growth in cases has been on the average of 1 million cases every 4 to 5 days. This is a trend that deserves a lot of attention, and the PTF is doing that. For us in Nigeria, the last 3 weeks have shown a slowdown in the number of confirmed cases. Indeed, in the last 4 months of testing, the lowest daily figure of confirmed cases, 138, was reported on the 30th of August 2020. The PTF still urges caution and vigilance on the declining numbers because the virus is still potent and very dangerous. This position is informed by the fact, in spite of our enhanced testing capacity, the number of samples collected for testing have not been very encouraging. While we intensify our targeted testing synergy and strategy, we still urge the states to expand the scope of their sample collection. The following 4 slides will illustrate the situation of testing in Nigeria. If you look at the slide that we have there, which Mrs. Ilorin would elaborate much more, you can see that in the month of April, our collections were just below 2,000 or so. I mean, it was below 20,000. May went up a little bit above 40,000 sample collections. Look at the rates of confirmed cases, the one in orange. In June, it went higher. In August, it got up to 140,000 plus. with correspondingly the confirmed of cases also high. But look at the drop in the month of August. So when we go to the month of August, with expanded collection sites, we were collecting less samples than even when we did not have as many collection sites as we had or we have in the month of August. The second slide, are we doing better in sample collection? Obviously, from these projections, you know that we are not doing better. States with a decrease in sample collection in the month of July were just 7. In the month of August, by the 25th of August, the number of states had risen to 32. And in all parameters, you can see the decline. I will leave the technical aspect of it to Ms. Lori to give you more specific insight into what is happening. The third slide, are states doing better in sample collections? The biggest increases in the month of July are there. The biggest decreases are there. She would explain and give you further details with whether we are doing better with sample collections. And the last of the slides is where are the states tested? You will see specifically the locations where the states are tested. And you notice that there has been a very sharp decline in testings and the locations of the testings as you compare July and the month of August. On a very good note, the last 7 days have shown a consistently greater number of discharges than confirmed cases. Particularly, we note with delight the report that Professor Akin Abayomi, the Lagos State Commissioner for Health, like many other Nigerians, have recovered from the infection. The PTF congratulates all those that have recovered and urge them to tell their stories. The Presidential Task Force also urges that the best choice to make is to avoid contracting the virus by strictly observing the non-pharmaceutical measures and other guidelines issued. Nigerians will recall that at the outbreak of the pandemic, it was predicted that the African continent, with its weak health infrastructure and propensity to high disease burden, would be the worst hit. A recent publication by the Weekly Science Review has indicated that despite having 70% of the global population, Africa has accounted for just 5% of global confirmed COVID-19 cases and 3% of deaths. Furthermore, a recent study by a group of African countries in East Africa indicates that Africa has weathered the storm of the pandemic with a death ratio of 1 to 10,000 persons at a total of 23,000 so far. According to the study, far more Africans have been infected with the virus and are now resistant to it for reasons such as more exposure to variants of the coronavirus and regular exposure to malaria and other infectious diseases, which prime the African immune system to fight new pathogens. The PTF is, however, studying the manifestation of the virus in Nigeria and in other countries and continents in order to understand the nature. This should ordinarily give us encouragement that we are winning the war against the COVID-19 pandemic. But unfortunately, the science, data, and experience from other parts of the world indicate that such data should be viewed with extreme caution, as it is prone to be very deceptive and could be misleading if we let down our guards and be influenced to deviate from our strategy of cautious optimism that has brought Nigeria this far. Equally important for us in Nigeria is that we are seeing a gradual shift in areas of high infection burden, with Plateau State reporting the highest number of confirmed cases. Of course, this could be related to increased testing by citizens of the state. However, we also need to look at the flip side, that there are a number of highly undetected cases lying around which we need to discover and deal with early. The World Health Organization has published a draft landscape of COVID-19 candidate vaccines. As at 28th of August 2020, a total 173 candidate vaccines are under evaluation. 33 are under clinical evaluation, 8 at phase 3 trials. 143 candidate vaccines are in preclinical evaluation. As the Presidential Task Force has always maintained, early testing, detection, tracing, and treatment remains the second best option for dealing with this pandemic, with the first being staying safe. In this wise, we implore Nigerians to get tested and present cases requiring treatment early to reduce our unavoidable fatalities. Testing positive to coronavirus is not a death sentence. Not testing and concealing cases of symptoms and presenting late is what leads to death. Get tested and get tested now. As we plan to reopen more sectors, we must stay the course and stick with our winning strategy, which is anchored on the ability of our health institutions to contain the virus, while we as citizens wear our mask properly, stay away from crowded places, avoid mass gatherings, maintain simple hygienic practices, and as much as possible protect the elderly and most vulnerable to this pandemic. It is in the above context that the Presidential Task Force appreciates the ongoing calls for reopening of the education sector, and indeed some subnationals are already making preparations for such. Whilst the PTF does not discourage making such preparations, we need to be guided by experiences from countries such as Germany, France, the United States, and the UK, where opening of schools in some cities led to an increase in confirmed cases and fatalities. As we end this phase, the PTF will be submitting the 7th interim report to Mr. President and will be guided by his directives on the next phase. The decisions and approvals will be transmitted at the national briefing on Thursday, 3rd of September 2020. I now have the privilege to call on the Honorable Minister of Health, thereafter the representative of the DG, Nigerian Center for Disease Control, and the National Coordinator to provide you with technical updates. Thank you so much for your support, your attention, and have a very good evening.
The Chair of the Presidential Task Force on COVID-19 Response, Honorable Ministers, the National Coordinator, Permanent Secretaries, ladies and gentlemen of the press. In the past 24 hours, we recorded just 138 COVID-19 positive cases in Nigeria, one of the lowest numbers in many months, giving us a total of 553,865 positive cases out of 403,347 tests that have been conducted as of August 31st, 2020. In the same 24-hour period, 199 persons were discharged from hospital, giving us a total successful treatment of 41,513 patients. We are beginning to see a situation where the number of those treated and discharged exceeds the number of positive cases detected. And while these figures may seem reassuring, they may be deceptive. And we cannot assume that the curve is flattening, since we are yet to perfect due diligence on our side. Testing has, for example, dropped quite significantly due to reduced sample collection across many states for reasons that are not clear in all cases. One state, for example, tested over 35,000 in July and less than 20,000 in August, while another dropped from 23,000 in July to about 4,000 in August. These are just examples that show that there may be more work to do and many more challenges ahead. Among the challenges will be the reason for us to worry about states where elections are contemplated, and campaign activities have led to a lot of frenzy and movement that create the risk of infection, while testing in these areas may decrease due to distraction. I shall commission a study group of the Ministerial Expert Advisory Committee to begin processes to examine all these developments and to bring up new knowledge which can guide response or may have an implication on government decision-making and spending. With a total of 1,013 fatalities recorded so far, the case fatality rate also slightly dropped to 1.88%, and the gradual fall is possibly an indication of improvement in response and treatment strategies to contain COVID-19, but it is also a common global trend. As long as we still record fatalities from this case, there is no room for complacency until we meet our goal to reduce fatality rate to less than 1%. Part of the strategy is to focus on setting up community support centers where, particularly in remote areas of the country, those who test positive may be kept away if they live in high-density areas, or those who are known to be vulnerable are protected from those who are positive. Our target is to test 2 million Nigerians for COVID-19, of which we have achieved barely a quarter, and to scale up to 4 million persons. For this, the collaboration with states and the FCT health sector structures is crucial. We urge all states and all state organs not to relent in strengthening surveillance and setting up sample collection sites in all local government areas and even in all the wards of the hotspot local government areas. The logistics for sample retrieval and testing must be assured, as the federal government makes provision for at least one laboratory in every state, with only Niger, Kebbi, and Taraba now outstanding. Most of the laboratories, however, are operating well below capacity because of poor sample collection. Plans have been concluded to set up and optimize laboratories in all states. As plans for Lagos and Abuja airports to reopen for commercial international flights become a reality, we must all raise our vigilance level. It is our collective interest and responsibility as citizens to guard against new cases entering the country, and in this regard, we must review our protocols to ensure early detection, isolation, and treatment of any positive case. While this protocol may cause inconvenience, like delays at the airport, it is a small price to pay for our safety and our health, and a small price to demand of travelers. Our contribution as individuals is simple: to keep each other safe by wearing our masks and observing all the social measures that have been prescribed. As we strive to bring COVID-19 under control, we endeavor to keep our eyes on other diseases that contribute to mortality, especially women and children in Nigeria. We do not want a situation where avoidable fatalities from other causes begin to rival or even surpass fatalities from COVID-19. Malaria is one such example for which we continue to strengthen routine services in our primary health care facilities. This morning, we disseminated the report of the 2018 malaria therapeutic efficacy studies for 3 artemisinin-based combination therapies which were tested in Enugu, Kano, and Plateau states. These studies are conducted at intervals to detect drug resistance to malaria parasite early enough to have treatment that works. The findings from this study have shown that the 3 ACTs, artemisinin combination therapies, shown them to be efficacious against uncomplicated malaria, though there have been reports of malaria parasite resistance to artemisinin in some countries in Asia. No resistance was observed in studies done here in Nigeria. Nevertheless, it is wise to test all fever cases and be sure it is malaria, and to treat only those confirmed cases with this medication. Thank you all for your attention.
Ladies and gentlemen, I'll just quickly explain the slides that was shown by the chairman so that we can understand some areas. For the first slide, I think that's the chairman already explained what we have there, the number of samples that we have collected over the months, and we can appreciate what is happening. That August, we're having a very low number of samples collected. For the next slide, I think that's where I would really want. Now, for this, we have states with decreased samples collected. That is, we have 7 states in July, and unfortunately in August, it increased to 32. We can appreciate that number, that the number of states that are now collecting less samples have increased to 32 in August. And then in terms of the increase in samples, about 1,000 per state. In the month of July, we had 13 states that actually collected over 1,000 samples. Now for August, no state met that target. That means we had 0 states collecting over 1,000. And then in terms of the states with over 1,000 samples in the month of July, we had 23 that collected in July, while only 18 for the whole of July. And for the whole of August, only 18 reported. And then in terms of the LGA, in July we had 515 LGAs that collected samples, and it decreased to 478. we can appreciate the decrease in August. Next. Now, this is showing us states with our biggest increase in July. They are listed there, and those ones with our biggest decrease. Now, let's go to August. Those with our biggest increase are Abia, Sokoto, Bayelsa, Zamfara, and Yobe. But the numbers are not significant at all. You can see the numbers. The highest is 682, with a big increase, while the biggest decrease are Kano, Lagos, Oyo, Edo, and FCT. These are our biggest states that have been recording a high number in terms of confirmed cases and also the number of samples that are collected. So this, we can appreciate what is happening in the state, and that's what has the August sample collection has decreased drastically. Now, this is where these tests being conducted, where being collected, the samples being collected. Now we have, in July, the number of states, that's Benue, Ebonyi, FCT, Lagos, and Plateau. All the states, all the local governments in those states had samples collected, and they were quite good, while only in Delta, Edo, and Ogun, only one LGA did not collect sample, as it is listed there. Now, in terms of those that are high LGAs that they did not collect sample, Kogi had 19, and the 19 is out of the 20 local governments in Kogi. Now we go to August. August shows us that Ebonyi, Imo, Lagos, and Sokoto, also all their LGAs, they collected samples, so none of them did not collect. And then we have Edo. But the part I want to bring out from here is that even though Lagos, we had a high number, all the LGAs collecting sample, but the number of samples collected was quite low. So that actually brought down the number of samples collected for August. And so they're listed there. And the numbers that have high, you can see Katsina, 24 of their local government. And then Kogi, actually no local government is collecting sample in Kogi State. So I think we can appreciate what is happening in the state, and why we're having very low sample collection for the month of August. Now I'll quickly go to what I really want to discuss today. And today we're talking about surveillance, our surveillance efforts, which also talks to this presentation. Because our priority since the beginning of the outbreak has been for us to be able to detect, trace, isolate cases of COVID so that we can prevent further spread of the virus. And for us to be able to do that, we should be able to collect samples, be able to detect, collect the samples, and isolate if they are confirmed. However, in a country of over 200 million people across 774 local governments, this resource-intensive is very rigorous. In many ways, we have intensified our surveillance activities to not only understanding the epidemiology of COVID within our context, but to help us to respond accordingly. This also feeds into our guideline, which we have produced, and advisories which we have developed and sent to states. Now, a few years ago, before, of course, COVID, we have a digital surveillance called SUMAS in Nigeria. And this SUMAS allows real-time case-based surveillance from health facilities to the local government, to the state, and then to NCDC. Actually, from health facilities, real-time, you get that information out at the NCDC, at the national level, and then the local government. But each level owns their data. Each level is able to, analyze and do a lot of work with the data. And we have actually leveraged on previous disease outbreak like Lassa fever in the country and now COVID. Each time a new case is recorded from any part of the country on SUMAS, we immediately view it at our emergency operations center on the dashboard. So using SUMAS at a glance, we can view the number of cases and specific indicators for each case, their symptoms, the current status, is a whole package that gives information on how a case is managed up to the laboratory samples that are collected, and this allows us to be able to harmonize our outbreak response. Since the beginning of this response, we have rapidly scaled up our deployment of SOMAs across the state. I'm happy to inform you that it's only 2 states that are left for us to roll out SOMAs, and that's Abia and Enugu. And from next week, we're going to do that. So before the end of next week, early September, we would have rolled out SOMAs in all the states of the Federation. And so this SOMAs, in addition, allows us to do contact tracing. That also helps us, which is one of the core surveillance activities we have employed in this response. And this entails follow-up of people that have been in contact with a confirmed case of COVID to ensure that they do not infect others. We monitor them regularly for 14 days to ensure that they do not develop symptoms and then not infect others. For this response, NCDC has trained state teams in improving surveillance, including the case definition and investigation and reporting. We have supported states to engage SOMAS data clerks and SOMAS surveillance officers to aid the states, even up to the local government level. Of course, we are grateful for the support of the Africa CDC, for the engagement of 200 community health workers. That's to enhance our contact tracing activities. In addition, the NCDC has continued to develop and update existing guidelines as the knowledge of the disease evolves. Recently, we have published and shared with states strategies to improve surveillance for COVID, and this is accessible via the covid19.ncdc.gov.ng. This is a guiding document that helps state teams to be more strategic in the implementation of the activities to improve the overall response to COVID. To date, preventive measures have been recommended have been informed by the epidemiological data on COVID in Nigeria, as well as observable trends across the country. We continue to urge Nigerians to support states and the national effort to curb this disease, and this includes adhering to preventive measures, such as the use of the face mask, and getting tested if you are showing any signs of COVID, and spreading information only from official channels. Thank you.
Gentlemen of the press, good evening. Today I'll be talking briefly on the issue of international travel and visiting some of the protocols we talked about. As you're aware, at our briefing last week, Monday, we announced a definitive date for the commencement of international flights, which will be on the 5th of September. And we are committed to making sure that this date comes through. The PTF, meanwhile, has been working with various agencies to develop protocols that will safeguard the well-being of international travel and prevent the importation of new infections, as well as prevent the further spread of COVID-19. There's no doubt that we need to ensure that the reopening of our international airspace is done in a manner that will promote safety, security, and economic recovery of our nation. I would like to appeal to all international travelers to take the protocols that will come into place seriously by adhering to every one of them. We are also developing awareness materials which will be available on social media and also available on normal communication channels, including our websites and aviation websites, to help amplify the protocols so that everyone, but especially travelers, would know and internalize them and make themselves familiar with the content. So I'd like to reiterate a few elements of the protocol. This applies particularly to people who are outside the country and are planning to come to Nigeria. So pre-departure, we need three things. One, we need a negative COVID-19 PCR test. This needs to be done from a certified laboratory, an accredited laboratory within the country you are leaving. It should not be a fake result, because we will develop systems that will allow us to identify results that are fraudulent. And it needs to be done preferably as close as possible to the time of boarding. That is within 72 hours of departure. But we will still accept tests that are valid within 7 days, simply because of the difficulty logistically of making sure that everybody has a 72-hour window for the test in some countries. The second thing is you need to register on Nigeria International Travel Portal, which we are developing. We hope it will go live by the middle of this week. We're not activating it yet, but a lot of work has gone through it. So you register on the payment portal and you will pay to have a PCR test done in country at day 7 of arrival. And you will print out confirmation. There will be an email confirmation that will go to the passenger, and there will also be some sort of barcode that will help us identify those that have paid for the test. And then the third thing we will need is the health declaration form. This is the same health declaration form passengers used to fill when they arrive in Nigeria. We've realized that it's one of the main reasons why we have a lot of congestion at the airports, and we are changing this into an electronic format so that you can fill it as close as possible to the time of departure. You fill it in a very factual manner, very transparent, honest manner, answer the questions, and then submit. And this information will come to Port Health in Nigeria, and you can also print out a copy. So this will allow us to quickly clear passengers as they arrive. You will undergo thermal screening for temperature, and you will also be asked for any change in what you have entered into the health questionnaire on arrival. If there isn't, we will move on to immigration. You will pass through immigration. You will retain your passport and exit the airport. Just to make it clear, persons that have symptoms consistent with COVID will not be allowed onto the flight, even if your PCR test result is negative. As we know, it depends on the incubation period, and you can still develop symptoms after you have had a negative PCR test. On arrival in Nigeria, you will be expected to present your copy of a negative PCR result and a proof of repeat test payment in Nigeria. We will also have within the portal the facility to be able to upload your COVID-19 PCR test result and submitting it electronically. So on the system, you will have 3 things. You will have 1, your health questionnaire that has been submitted electronically. 2, you will have evidence of payment for a COVID-19 PCR test. And then 3, you'll be able to upload your COVID-19 PCR test that was done in your departing country onto the system and submitted electronically. So at this point, as you exit from the airport, you will go home and self-isolate for 7 days. Self-isolate doesn't mean that you interact with all your family members and have dinner and lunch, etc. with them. No, you self-isolate in a separate room on your own, and do not mix with family members during the period, and neither would you receive visitors at home. But you self-isolate for 7 days, and on day 7, you will present yourself to the sample collection center. There will be an arrangement to have some sort of text messaging to you a day before your test to remind you to present at your sample collection center. The laboratories that have been accredited to do these tests will have the responsibility of making sure wherever you are in the country, you have the test done. And day 8, or afterwards, as soon as you get your results, you will exit from self-isolation if your result is negative. Persons who test positive will be managed based on the national guidelines. It's important we get this right. For the moment, we do not have the infrastructure at the airport to commence testing at the airport, but we hope in the coming months we'll be able to make suitable arrangements, and we might even have a rapid diagnostic test that would allow us to have real-time access to results straight away. But for the moment, this is the arrangement that will come into place. There will definitely be sanctions for failure to comply. Sanctions to the airlines if they allow passengers without a COVID-19 PCR result to board. They will be sanctioned on arrival in Nigeria. That is the airlines. For passengers that decline to do the test, at day 7, we will still allow them after day 14 to have the test done, after which their details will be forwarded to Port Health, Immigration, and parts of the security services. And it's very likely we will put in place measures to enforce this by suspending travel for up to 6 months or denied foreign travel altogether. But beyond the sanctions, because as responsible citizens, we all would want our country to continue to be COVID-free once we get on top of the pandemic. So we expect the vast number of travelers will continue to comply with these simple, straightforward measures that we are putting for the benefit of our country and for the health of our citizens. There's no doubt COVID-19 is real. There's no doubt a lot of countries are now starting to experience what we would call a spike related to either relaxation of certain phases or difficulty in complying with these measures. But nevertheless, it's important that we continue to maintain the momentum so that our numbers will continue to decline and we'll be able to get back to normal once again. Thank you.
Of numbers in testing. I did say that we have no reason to be happy about the reduction in number of positive cases because the testing is down. And if you are not covering the whole country sufficiently, if you are not getting samples from all the areas, you cannot make a declaration as to whether you are flattening the curve or not. So you must have a critical number that assures you that you are not missing out anything. If you look at the countries of the United States and European countries, they reach a certain level where the numbers they are testing are increasing, but the numbers they are finding are reducing. But and they are covering the areas that they intend to cover with the percentage of tests. I said just now that we are targeting, want to get 2 million tests done. Then you know that you have covered a large number and be able to make a pronouncement as to whether your curve is flattening. But right now, we don't know why the testing is exactly why it's going down. That's why we are commissioning a panel of experts. I told you we have a ministerial committee of experts that we are going to commission to look into this question, carry out verbal autopsy, and go around and ask the stakeholders and the various participants questions and be able to come out with a reason, or at least an attempt at a reason and explanation. Now, the part of the reason why this test may go down is a matter of guesswork, is that maybe the fear factor is reducing. When COVID came out, people were very terrified. They all rushed to get tests done. People complained they couldn't get tests done. But as the survivability increases and improves, I think the fear factor may have reduced. And so people are probably not so anxious anymore. They think, well, they'll make it, they don't need to. That's a guess. But we shall listen to what our experts have to tell us is responsible for the drop in sample collection. We are trying to sensitize those in authority, the states. Tomorrow we are having a meeting with all the CMDs and all the MDs of our government, of our federal teaching hospitals, to also spread this message to them and ask them questions, how they feel in their own states. As you know, every state has at least one teaching hospital or federal medical center or both. And we want to hear from them and learn from them how to modify our strategy. We shall also seize the opportunity to talk to the governors at the Committee of the Governors Forum on COVID-19 and explain this problem to them so that they all buck up and not feel too confident. I did say that we have no reason to rest on our oars. We have a long way to go. We need to spread out this testing. It is the responsibility generally of the states. We have prescribed that there should be at least one sample collection center in every local government. We have even said that where you have a hotspot local government, you can have a sample collection center in every ward. It's not difficult. Collecting samples is not really a very difficult activity. Then you need the logistics to be able to retrieve samples you have collected. The laboratories are there. We're trying to make sure every state has one. We have also made it clear that if any state collects samples and the nearest center for testing is not necessarily your own state capital, but another one is nearer to you, can use it also. You can take advantage of the proximity of a testing center so as to make things easy. The other week, we commissioned a large number of motorcycles for primary health care, which we have said can also be used if called upon by state governments to help in retrieving samples. So we're trying to put everything down there so that the operators on the ground at the local government and state level can take advantage of whatever options that are being put there to increase the scope. We want to be sure that we are managing the situation correctly, and we'd have to depend on the collaboration with the state governments and local governments, and also the population generally, for this to be successful. As for malaria and COVID-19, well, the malaria plasmodium is a single-cell animal, that creature that causes what you call malaria. COVID is a virus. It doesn't exist on its own. It has to enter a cell to exist. So there are two actually quite different kinds of creatures. But the symptoms they have will be fever. They have that in common. So, and you can have still other ailments that give you fever. So a fever is not definitive for one. It's a suggestive symptom. It's not definitive for any. It's a suggestive for a range of health issues. And it is left to the doctor to now go further and carry out the diagnosis, look for additional symptoms that will confirm one or the other, and then probably use a laboratory to confirm the case, exactly what the diagnosis is. So you can have general medicines that bring down the temperature. They take care of the fever, but they do not necessarily destroy the pathogen. So when you say you are treating malaria, you can give something like paracetamol that brings down the temperature, but it does not destroy the malaria parasite. It does not. So you can do the same with any kind of fever, bring down the temperature without destroying the parasite. But to be able to get a cure, you have to destroy the parasite with something specific. And that's what the ACT does for malaria. It destroys the parasite. That is the artemisinin combination therapy, which we validated today, 3 types that are functional. They destroy the parasite, but then again, you have to bring down the temperature with something else. Now, that will not necessarily work against the virus, because the virus is not necessarily sensitive to ACT. So you don't put them in the same basket. I think that answers the question.
Thank you for the questions on I think contact tracing seems to be one of the issues here, and I'll answer the 2 questions on contact tracing together. Now, for contact tracing is one of the very key areas for, stopping the transmission of the virus. Of course, we say that once, if you have contact with a confirmed case, you are followed up for 14 days. And within that 14 days, if you develop symptoms, you're tested. Now, the way it goes is that contacts are categorized according to how how close they were to the confirmed case. We will have high-risk contacts. Those are the ones that are actually advised to self-isolate. The very high-risk contact will self-isolate because there is a possibility that the virus has been transferred to them. And these high-risk contacts, how do we identify them? Those that will ask questions. If you did not put on a mask, if the confirmed case was not wearing a mask at the time of contact, and the other person too was not wearing a mask, that at the time of contact, and that person is very close, had a close contact with the confirmed case, that's a very high-risk contact. So we look at all those criteria to determine who is high-risk contact. And like I said, high-risk contacts are told to self-isolate so that we follow them up, so that we don't transmit it within the community. Now, what are the kind of strategy we do is that we work with the state. And at the initial stage, when we were doing the institutional quarantine, we'll quarantine the contact, of course. But now there is no institutional quarantine. So what we do is to advise the contacts, the high-risk contacts, to stay in a separate place from the family members, so that you don't also infect the other family members. We work with the states. We have meetings with states every fortnight to look at their challenges, because each state, like I mentioned earlier, we have their specific challenges that we try to address with them, and most of them are technical challenges. The ones that are political, we refer to the highest level. And like you ask, will it help? Of course it will help, because of course if there is a contact that you remove from the community, a high-risk contact that you remove from a community, that will help transmission, because it means that that contact might not be able to transmit. And let's not forget that we have asymptomatic people around us, those that do not show signs and symptoms. And so a high-risk contact might be asymptomatic and by not show any signs or symptoms. So yes, it's a very key area, function in breaking the transmission. Now, I think this was to the NC, but I'll just quickly talk about it. Plateau State as epicenter. The evidence is that we have more cases, confirmed cases, being reported from Plateau State. And we have told you here that Plateau State decided to be very aggressive, and they collected a lot of samples in all their local governments. And so they have been able to, because they are reporting more confirmed cases, so of course we report them as the epicenter right now. And then in terms of the, the trend, what are the factors? What factors could trigger the second wave? Well, I think the Honorable Minister talked about that. When we are not doing what we are expected to do, not adhering to the non-pharmaceutical measures, and then we are being careless. We are opening up, and then we are not doing what we are expected to do, it could lead to that. And we are talking about schools reopening, we are talking about business offices, workplace reopening, and people are careless about what they're doing. We are not collecting enough samples. People are transmitting within the community, and most people are symptomatic, and so they are going their free way. Of course, we might have that kind of, second wave of surge. And then the task force at the state. Now, I mentioned that we meet with the states every fortnight, and we discuss more of technical issues with them, and where they have issues with the political level, that's the task force, we escalate to the PTF, and the PTF talk to the governors. We have the governors forum where they address issues. So those issues are always addressed at each level. At the technical level, the NCDC does its own part. The PTF does their own part as the upper level. And I think that's what we're doing. Thank you.
So the first one has to do with how do we scale up sample collection centers. So what we have been doing, as you're aware, we now have about 66 laboratories. We started off with about 3 or 4 when the PTF commenced back in March. And since then, we have increased the number of laboratories. But of course, the increase in testing, it has not been consistent. And what we have been doing is working closely with the states as well as with our partners. Our partners have a lot of assets across the country. So an example is Kaduna State, for instance, as well as Plateau. What we have been doing is we've been working very closely with WHO and some of our partners, as well as the state EOCs, to ramp up testing in those states. And this fits in very well with the results from Plateau State. The reason why the numbers in Plateau are high is because the number of samples being collected has increased significantly. And it's the same thing with Edo. If you test, you will find. We still have a lot of COVID-19 infections in the country. And as the chairman said earlier on, the more you test, it's really a reflection of the frequency of testing. What is probably more reliable is if you look at the positivity rate. So if you test a lot and your positivity rate is low, then at least you will have some degree of confidence that you're getting on top of the epidemic. And the question as to whether Plateau is the epicenter or not, I don't really like the term epicenter because it's a semantic. It's derived from earthquakes. It's really a description. It describes a focus, a hub, as an epicenter, whereas in an epidemic situation, I would prefer the term hotspot, because at the end of the day, you are not looking at a single location that is then seed into other parts. What you have is actually an increase in the number of cases, possibly derived from increased case finding more than anything else. So we congratulate Plateau for testing a lot more. They are the ones that are doing the right thing, because for you to be able to know that you have a problem, you need to be able to define it. And with COVID, you can only define whether you have a COVID problem or not by testing. Those states that are not testing enough, we would continue to call on them to set up apparatuses to enable them to test more. Funding is no longer a major reason for not testing. We know that virtually all the states have received a small amount of funding from the REDISI grant, and we are working closely with the Honorable Minister of Finance to make sure that they receive their remaining operational funds for the COVID response. If you test a lot and you don't find anything, as what is happening now in Lagos, then we can say that yes, we are fairly confident that we are getting on top of the problem. But if we play ostrich and do not look for the problem, then we wouldn't really know what is going on until we move to another phase. Just as is happening now with schools and exams, where we are coming up with cases, 20 cases in an exam center, for instance, I believe in one of the states. It just reflects what is going on in the community, really. So my plea to the states is please test. It's the fastest way we can get on top of this problem. If you test widely and you don't find a case, then great. We can open up and we can get back to normal fairly quickly. The last question had to do with our level of preparation, particularly in terms of the laboratories for the airports. So for Lagos, they already have a portal that has been up and running for, I think, for some weeks now, and they have about 10 laboratories that are testing, and we are happy with the potential capacity of these labs to take up the passengers that are coming in. With Abuja, we're still working on this. So far, we've got possibly two laboratories that will be able to accommodate the current number. And we hope over the next 1, 2, 3 weeks, we'll have an additional 4 or 5 laboratories, bringing the figure to about 6 to 7 that will be able to serve Abuja. And that will be quite sufficient. In terms of the level of preparation, we've actually gone very far. The main preparation really has to do with the need to set up electronic systems. We want passengers to have a good experience at the airport. Despite COVID, despite the fact that this is the new normal, we do not want passengers to come and spend huge amounts of time at the airport after they have landed and increase their risk of exposure to COVID, i.e. they do not catch COVID in the plane and they end up catching it because they are spending hours waiting to be cleared. So we want the experience of passengers to be very positive. It's important for our economy that our airports function very well, but it's also important for our country that we continue to keep safe and we keep COVID out of our country. So we will make sure that the systems that will come in place are as electronic as possible, as convenient as possible for passengers, and we will also make sure that whatever documentation is made available is fully adhered to, and any measures that are required to enforce this, we will work very closely with the authorities so that we have a tight system that would allow people to go home with their passports, have that freedom of being able to continue to proceed with their own personal documents without worrying about their passports getting lost at the airport, and a week later having their test. And if it's negative, we have reduced the period of quarantine or self-isolation from 2 weeks down to a minimum of 8 days. So that would allow people to get on with their lives much earlier on. We know that if you test immediately on arrival, you pick about 7% of those that would PCR convert. If you test at day 5 of arrival, you pick about 85% based on the modeling and the scientific data available. If you test at day 7, you pick about 94%. And if you test at day 14, you pick about 98 to 99%. So there's no doubt testing at day 14 is the most reliable because it will pick up the whole incubation period. But we know that it's incredibly difficult for a lot of people to lock themselves up for 2 weeks in self-isolation. So that's why we've taken the pragmatic approach of saying 8 days, and the assumption is that the majority of people, if you really confine yourself to those 8 days, you should be fine. We should be able to minimize the risk of transmission. For people leaving the country, of course, it's important we don't spread COVID to other parts of the world. Different countries have different requirements for travel. Increasingly, a lot of airlines are asking for negative COVID PCR results before you even board. And the laboratories that are being set up now, the private labs, will also provide those services, and you should be able to get results that would enable you to fly. At this point in time, we do not want the public health laboratories to be used for travel-related purposes. It will distract them from their primary responsibility of dealing with the epidemic. And that's why we are making arrangements with the private sector to drive this. This is what happens in a lot of countries, and that's why we're putting this in place in Nigeria. Thank you.
Just being referred to by the NC, said roughly about 10, 20 of them. But we've confirmed that all of them are back in class. They have now been tested negative. All of them are discharged. We do not have any further cases. There were 4 in Gombe. There was 1 in Kwara. There was a few in Bayelsa. But all of them this morning, on my way, expecting schools that are in exam classes, I confirmed from the WAEC supervisors, or those of them that have been discharged and been tested negative, they came back. This thing has a way with children. I think they're not as, they don't come down with it as much as the rest of us. But that's our situation report at the moment. We are still getting feedback from the field in case there are any new places where this may crop up. As to whether we're reopening schools at all, that discussion is ongoing. We've received the feedback from all our universities. They've responded as to their state of preparedness. That is being tabled at the PTF, and we've agreed on a framework that will help decide how they come back to schools, where tertiary institutions by their nature are semi-independent. They are constituted, there are councils that will take responsibility as to who returns, when they return, what departments, because the universities are not like secondary schools or primary schools. Universities, you may be in your 40 and still be carrying a paper from year one. So there's no such thing that you have. You may have carryovers. You may, I'm not saying everybody is that, but you may have thesis, you may have your papers that you're delivering, you may have courses that cut across. I'm sure many of you who attended universities may be in a particular class, but sharing a GS course with, say, another department. Universities are not run like primary schools. So really, that decision is up to proprietors and the governance structure we have in those places. If you look at polytechnics and many of our colleges of education, the course content is not just strictly you go to class, they teach you something and you go away. No, that's not how tertiary institutions work. So the governance around that is what is being articulated at the moment. We have a broad agreement with almost all the institutions and their supervisory organs. The National University Commission has given us a full brief of what the universities are doing. The National Board for Technical Education has also brought in a full brief, and the National Commission for Colleges of Education are also working on their brief. Now, we'll bring all of this together because you're not trying, whatever decision you're going to give out from here will be a national guidance that then will, Lagos State, Imo State, all the states around Nigeria will need to translate them into what they can use. And then the governance structures around the institutions themselves will then unbundle that to the students. It won't be a one-size-fits-all, but it will be a guidance procedure that will be emanating from it as a national response. Thank you very much.
To the states in order to help them show up their sample collection. I totally agree with you that that's our weakest point now, or our weakest link, the issue of sample collection and the need for it to be ramped up in such a manner that we'll be able to have a clear idea of what is happening in the rural levels and in our communities. And like Dr. Sani rightly said, we have, at the federal level, given all the necessary support to the states, to the subnationals. In terms of resources, not only money. Money is part of it, but not only money. Even the items that we receive from the portal that we launched last week, it's quite evident that if you had gone into it and looked at it, you notice that the items that we have received by way of donations from countries and development partners have also gone to the states. The distribution is not restricted only to federal medical facilities. It goes even to state medical facilities. Whichever facility in a state that is dealing with issues of COVID-19 would have a share of what we have received. Resources have gone to the states. I did mention last week that they have received, most of the states have received the original amount of 100 million, I think, each state, to help them in their preparations on setting up their operation centers and also structures for their community engagement in terms of driving the message of the response. In the 2020 revised budget, there's a provision of 1 billion for 32 states. This is coming from the federal. We're not talking about the state budgets. We only accepted the states that are earlier received, like Lagos, which got 10 billion, Kano got 5 billion, Ogun and Jigawa, I think, got 1 billion each. But the other 32 states have been provided for in the federal budget, the revised federal budget. So you can see that we are concerned about what is happening at the state level, and we are resourcing the state levels to see that they ramp up their sample collection. I know there has been, like I said in my remarks, fatigue has come in, and even on the chart displayed, the issue of fatigue, COVID fatigue, even for your reporting as journalists, there has been fatigue. That's the reality of life. Everybody is fatigued. And we're just waiting for this thing to get over. But you see, as we await the arrival of vaccines, we have something that we can do to dampen the ravaging effect of COVID-19. And the only weapon that we have in our hands is to adhere to the non-pharmaceutical measures that have been put in place. That's the only weapon for now. The vaccine will come with its own protocol. But right now we have something that we can do. And that's my call to the entire nation. That this is not the time to be exhausted or to be fatigued with COVID. Because COVID is not going to abate just because you are tired of it. It will continue on its ravaging effect. It will continue with its spread at the community level. You go outside Abuja and visit some of these states, you wonder whether they live on a different planet. Totally oblivious of what you are doing. When you assume with a mask, you are like a masquerade that has just appeared on the scene. And as a matter of fact, in some communities, they think you are infected. That's why you are putting on the mask. But it's important that we continue to drive the message that for now, no cure, no vaccine in sight. It's only care and management if unfortunately you get infected. But collectively we can resolve that, look, let's reduce the level of infections. And the only way we can do it is to comply with the non-pharmaceutical measures that have been put in place. Farouk, yes, in similar vein. Yeah. Most of the states when you go to, it's the same experience I had when I was home this weekend. They think it's over. But true, it's not over. That's the truth about it. We can see the figures. As a matter of fact, in the month of August, virtually within each 4 days, the increase globally is over 1 million. Much more than when we even started. You saw from the projection how we were collecting samples. And because we were busy collecting samples, we were finding. As long as you don't collect samples, that's the only way. You don't wait until the symptoms begin to develop before you collect samples. It is the responsibilities of the subnationals to prepare at their local government levels to open sample collection centers and rake in the samples so that those samples are tested for them to have a clear picture of what is happening in their local government areas. I know we are all fatigued, but this is not the time to relent. This is the time to upscale. And that ties me to the issue of contact tracing. At this level, what contact tracing are you doing? The thing is already in the community. Everybody is a suspect. Everybody is a suspect. So all we need to do is to go into the local governments and ensure that in each local government, we have a sample testing center or a sample collection center. We can't have laboratories all over the places. But you remember when we started, the issue was, where do I find a place to test? Now, there are bound several places for testing. We've racked up the testing capacity from 2 labs when we started to 66 as of today. There are only 3 states, and I understand from the representative of the DG of NCDC, that there are people are on the field in Kebbi, in Zamfara, is it Taraba and Zamfara? And okay, it's Kebbi and one other state in the northwest, and Niger. Kebbi and Niger and Taraba are the only 3 states that they are working to ensure that they get their laboratories up and doing. Even though the other 36 states plus the FCT have testing centers. Some have 3, some have 4 laboratories where we can access testing. Why should our testing numbers drop? Why should our testing numbers stop? Right now, I think we have a testing capacity of about 15,000 a day. US is testing about 800,000 daily, and they are complaining that that is not sufficient. But you see, it explains why they've been able to establish, they have reached the Rubicon of 6 million by today of confirmed cases. Why? Because they have consistently, even with the 800,000, the criticism is that that is not sufficient. Ours, we are just testing between 2,500 to 3,500 on a daily basis. It will be very difficult for us to even have an idea of what is happening in the local government areas particularly. So I enjoin all states to ramp up their testings, collect the samples, and turn them in so that we have a clear picture. And as we await the arrival of vaccines, 6 weeks, 6 months, 12 months, 18 months, or 2 years, let's use the weapon that we have in our hands and deploy the non-pharmaceutical interventions that we have put in place. To Malam Faruk, batun corona ba inda ya tafi ba, yana nan. An mutane suna zato a gida, a cikin karkara, a cikin jihohi akan cewa corona, maganan corona ya kare, ba gaske a cikin magana. Corona yana nan kuma yana kama mutane kuma yana kashe mutane. Don haka dole mutane su yi la'akari da wannan magana akan cewa babu magani, babu vaccine. Abinda yake hannunmu a yanzu shine waɗannan shawarwarin nan da muka bayar na cewa in za ka fita ba ka tabbatar kana da wani kunshe bisa hancinka da bakinka, abinda ake kira face mask. Kuma in za ka tafi ko ina ka je ka nemi ruwa ka wanke hannunka da sabulu. In baka da wannan, akwai abin da ake kira sanitizer, ana sai da su ko ina. Amma ka kuma muka ce kara a buɗe gun aiki ko inda ake waɗansu sana'o'i sai an tabbatar akwai waɗannan abubuwa. Mun ba da shawara kuma kara jama'a su cunkusu a gu ɗaya. In za ka fita, in za ka tafi aiki ko za ka tafi waɗansu ziyara, a tabbatar akwai ɗan fili ko ɗan tsawon abin da fili tsakaninka da mutane. Ba dole ba ne sai ka fita in baka da dalilin fita. Jama'a su sa hankali akan cewa corona tana nan, kuma to corona kamar ɓarawo ne, yana duba kawai lokacin da za ka ce ka kau da kanka. lokacin ne za ka ga bala'in corona. Fata na shi ne akan cewa za mu ɗauki waɗannan shawarwari wanda muke bayarwa da muhimmanci, mu yi abin da za mu kare kanmu, za mu kare iyalanmu, kuma za mu kare kasa. Na gode. Have a good evening.
Thank you very much, Chairman PTF. That effectively brings us to the end of today's national briefing. But we must remind you of a number of things, the messages that are coming out of today's national briefing. The first is that the PTF urges to ramp up the scope of their sample collection so that detection, tracing, isolation, and treatment can take place. As we plan to reopen the international airspace, we must raise our level of vigilance. We must also review our protocols to avoid new importation, and all of this will be taking place. Closely related to that is the fact that preparatory to the reopening of the airspace on Saturday, 5th, there will be an inspection at the international airport on Thursday. The details will be communicated to you, and we'll all gear up towards the visit to the airport on Thursday. We must continue to preach compliance with the non-pharmaceutical measures that have been put in place. We urge you to mask up to bring down the rate of spread of the disease. Your mask is always the cheapest, the simplest, and the most effective way of fighting this virus from spreading. Finally, so much has been said about fatigue today. We should never allow fatigue to set in. This is the time to renew our energy and our determination to fight this virus totally. Let us overcome fatigue by renewing our energy. COVID-19 will never be tired, so we must never be tired. I thank you very much. God bless Nigeria. We'll see you on Thursday when we mobilize to visit the airport. Thank you.